We all know someone affected by heart disease, as it's the leading cause of death for all Americans, regardless of race or ethnicity. But did you know that Black adult Americans are at a greater risk than any other ethnic group?
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist HealthTalk.
Hi everybody, I'm Kendis Gibson coming to you from the Baptist Health Newsroom. Research shows that Black adults are 30% more likely to die from heart disease than whites. And conditions like diabetes and obesity, hypertension, put them at a higher and increased risk. To talk about ways the Black community can improve their heart health, we are pleased to join right now with Dr. Adedapo Iluyomade, who is known to his patients, thankfully, as Dr. Dapo. He is a preventive cardiologist at Baptist Health, Miami Cardiac and Vascular Institute. Thank you so much for being here. Really appreciate it. How did I do with the naming?
The name, not bad, not bad.
Okay.
I've heard worse.
Haven't heard better. All right, doctor. And a reminder before we dive into this topic, I want to remind you that are watching to send in your questions in the comments. We're here for you and happy to answer any questions that you may have. But right now, I want to deal with the questions I have for you, doctor. And while heart disease is a leading killer for all Americans, some communities face an even greater risk, as we mentioned, the African American community. Why is the Black community at a higher risk, 30% higher for heart disease compared to others?
Yeah, so the Black community, despite efforts that have been made over the years to reduce cardiovascular disease amongst the entire population, and we've seen pretty good results, disparities still exist with respect to the Black community. And this really comes from the increased prevalence of risk factors for heart disease, mainly hypertension, diabetes, obesity, et cetera. And so I'm sure we'll get into it, but there are many causes for that. And that's really the root of the problem.
Can I back you up for a second? Because, as I think about heart disease, I think about that term.
Yeah.
It can be confusing for many folks because you think about diseases, you think, cancer and other things that can either be cured, you live with, or you die from it, sadly. Yeah. What does it mean when we say heart disease? Is that something that people just kind of live with for long term, or what?
Yeah, so, I think the most important thing to kind of stress when we talk about heart disease is really that 80% of it is preventable. Yeah. So the prevention of heart disease is really where we focus a lot of our efforts. And once someone has heart disease, they continue to live with it. And how their life kind of pans out with respect to the disease depends on how well those risk factors are controlled and how healthy they're living. So heart disease, that term, means actually a lot to us. So this includes coronary artery disease, which is the buildup of plaque in the arteries, which is what most people refer to. That's what leads to heart attacks. And that's what people usually mean when they say heart disease. Yeah. But the term also encompasses heart muscle disorders, abnormal rhythms, and a multitude of other conditions that affect the heart. Exactly.
A number of different things. Well, as you know, obesity is a national epidemic and a major contributor to some of the leading causes of death in the U.S. And Black adults have the highest obesity rate of any race or ethnicity for that matter. What role does obesity play in developing heart disease?
Yeah, so you're absolutely correct that obesity is probably the number one issue when it comes to public health in the United States right now. And the way that obesity affects cardiovascular health is that it increases your risk of developing those risk factors for heart disease. So that's hypertension, increases your risk for diabetes, increases your risk for kidney disease. And so when we look at obesity, we really should be, thinking of it as a chronic condition that deserves to be treated just like anything else. And so by the year 2030, about 50% of the U.S. will be obese. And so, it's an epidemic that we're facing each and every day in the clinic.
And a growing one at that. What other clinical risk factors make Blacks more susceptible to heart disease?
Yeah, so, I think when we look at why Blacks have heart disease, we identify hypertension being probably the number one cause, and uncontrolled hypertension, early onset hypertension being a big issue amongst Black Americans. Diabetes, 1 out of every 3 African Americans with diabetes are undiagnosed. So not even knowing that they have diabetes. We know that social factors play a role, so chronic stress, access to healthy foods, et cetera.
Let me have you dive in more into that, because all of that stuff doesn't happen by osmosis. And you don't just immediately, or is it DNA? Are you just born with diabetes, hypertension? Black Americans are 30% more at risk. Is it the diet? Like Hispanic American men and women are 30% less likely to have heart disease than non-Hispanic whites. Is it the diet? Is it DNA? What is it?
Yeah, so it's multifactorial. I think there have been a number of studies looking at, is there a genetic component? And you see some signals towards certain genetic abnormalities, which we all have for that matter. But there may be some signals to why African Americans develop hypertension earlier and more aggressively. But also you mentioned diet. And so when we look at the typical African American diet in the United States, regardless of geography, African Americans tend to eat a quote Southern diet or a soul food diet, which has many positive components such as greens and some vegetables, but also
not the sort of way I cook the greens.
So there are collard greens, there are sweet potatoes, etc. Depending on how you cook them, they could be not so healthy. But then they're also big or rich in fatty meats, and the cooking oil that's used, a lot of the condiments, etc. So when we look at the diet, that's a big issue. But also there's some social factors. So mistrust of the healthcare system in general due to historical mistreatment by the healthcare system here, and also access to safe spaces for physical activity, health education and outreach, access to quality care. So these all play a factor in why people, not just Blacks, but all people, develop these conditions, whereas others don't.
That makes a lot of sense. So with the heart being arguably, I'd say, the most important organ, what other illnesses can arise in someone who doesn't have a healthy heart?
Yeah, so there are 3 that I would like to highlight. I think when you have an unhealthy heart, the first place that we think of is the brain. And so people with heart disease have an increased risk of stroke. And then as we go through the rest of the body, as we go from the head down, kidney disease is increasingly prevalent in those who have heart disease. And that's a major risk factor for not only end-stage kidney disease, but also death. And then peripheral arterial disease, which is disease where plaque builds up in the arteries outside of the heart. And so this all stems from that incident heart disease.
So you really need to pay attention to the signs from the get-go. What are some ways, would you say, to reduce the risk of developing heart disease?
Yeah, so the main ways, I'm sure everyone knows, eating a healthy diet, exercising, but I think some of the ways that we can reduce heart disease that people may not be so familiar with are managing stress, so psychosocial stress, managing sleep, so improving sleep hygiene, not only the quantity but the quality of sleep, and then routine screenings. We have a lot of great screening tools for heart disease now, and that people should meet with their doctors and take advantage of some of those.
Can I have you go dive into that? So you say healthy diet.
Yeah.
There's been all this talk about the Mediterranean diet and certain diets being one of the ones that will allow you to live a long life.
Yeah.
Is there such a thing? Is there a specific diet that I should say, like, all right, I'm going to get rid of the ham hocks and I'm going to switch to this?
Yeah, so I think the diet debate is one that's ongoing, and where we land with the Mediterranean diet is that that's the only one that has been studied sufficiently and shown to reduce cardiovascular disease and cardiovascular events. So that's the one that we recommend, absolutely.
All right, good to know. Exercise. So cardio, what would you recommend on a daily basis or not so daily basis?
Yeah, so aerobic exercise, we consider moderate intensity exercise to be the goal of about 30 minutes 5 times a week. Okay. So that's 150 minutes a week of moderate. If you like to do HIIT and you like to get out there and push yourself, 75 minutes is enough. And then also adding in 2 days a week of weight training is super important.
And that's no matter the age?
That's no matter the age.
Okay.
And, when we look at adolescence, when I think of when I was a child, we were always outside running around. Now, about 2% of adolescents, so age 12 to 19, actually meet the physical activity requirements set by the CDC.
Wow.
For a healthy lifestyle.
Wow.
Yeah.
Which, as a parent, then the goal is to like hide their phone on the other end of a track,
yes.
and then maybe they'll run to it.
So on the other end of that,
exactly.
Yeah.
So sleep, you said it's important, not the length of sleep, but quality of sleep.
Yeah.
Dive into that.
Yeah. So what I'm getting at there is that there are conditions that affect sleep. So sleep latency issues. So people who have trouble falling asleep, waking up in the middle of the night, and then most importantly, obstructive sleep apnea. So sleep apnea, we know, increases the risk of heart disease, heart failure, and also abnormal heart rhythms or cardiac arrhythmias. So, if you have sleep disorders or someone's told you, someone sleeping next to you told you, you snore, you stop sleeping and you stop breathing in the middle of your sleep, it's very important to do a sleep study, and you can do that at home now, so it's very easy to do.
I'm thinking also a good friend just recently got a mask for her mouth.
Yeah. Yeah.
Is that a good thing?
She got it prescribed.
She says it worked. No, like Amazon, $17. But she says it works. She might look like Hannibal Lecter in the morning, but still.
Yeah, there are a lot of pieces out there that people can buy, but I would recommend seeing a sleep specialist and getting one prescribed that fits right and is the right settings, et cetera.
Awesome. Let's get to some of the questions that we saw that are most popular on the internet when it comes to this topic. Is family history a good indicator of what I can expect when it comes to my heart?
Family history is extremely important. One of the things that I always stress to people in the community is to talk to your family, ask them what they have. In a lot of households, we don't talk about our conditions. And so we know that especially if someone has a male relative, first-degree relative, so that's a parent or a sibling, who's had a heart attack or been diagnosed with heart disease less than 55 years old, or female relative less than 65 years old, they themselves have an increased risk of developing heart disease at a young age and can be screened earlier, and they can take kind of a proactive approach to lifestyle. There are also conditions that are inherited, so that are just passed down genetically. Some of them we're able to detect, some we're not, but knowing what runs in your family can be very helpful.
And I assume those DNA tests kind of help with that as well. Yeah. What are some warning signs of heart disease, early warning signs?
Yeah, so I guess when we think of warning signs, it depends on the type of heart disease that we're discussing. And in particular with coronary artery disease, or the disease that leads to heart attacks, chest pain, chest discomfort that's unusual, especially if it occurs with exertion or with physical activity, can be a big warning sign, even if it's mild. If that chest pain radiates to or moves to the jaw, to the left arm, if it's associated with shortness of breath or sweating, fainting, feeling of irregular heartbeat or palpitations. These are all signs that something might be wrong. Swelling in the legs is another one that can easily be picked up on and may be a sign that something is up with the heart.
Yeah, and you mentioned the chest pains. At which point would you say you stop the exercise or whatever, or go to the urgent care or the ER?
Yeah, so my recommendation is, if you have sudden, severe, usually central chest pain that occurs either at rest or with physical activity, it's time to go see a professional. That pain, if you're having a heart attack, typically will last about 30 minutes. It feels like an elephant is sitting on your chest. You may get jaw pain, you may get left arm pain, and this is a sign that either call 911 or go to the ER.
Okay, well, that's a good breakdown of all of it. Where's the trend line overall right now when it comes to African Americans, Black Americans, and heart disease? I mean, obviously there have been a lot of strides when it comes to improving and survivability overall, but are we still kind of bucking that trend, and you're still noticing a large number of Black Americans coming in there with
overall in the United States, we've seen decreased numbers of heart disease. But when we look at the disparities, so the gap between non-Black population and the Black population, that gap has not closed. So despite lower overall numbers, there's still a difference there, and that expands to even include life expectancy. So Black Americans still have a life expectancy of about 3.5 to 4 years less than their white counterparts. So yes, we're making improvements, but the improvements that have been made are kind of flattening out. And so where we go next really depends on the actions that we take today.
All right. And one action I will take is to take on the Mediterranean diet as much as possible. So I'll just have a lot of baklava. That's probably against the rules. Really appreciate it.
A little bit.
Yeah. Dr. Iluyomade.
Yes, perfect.
Oh, yeah, sure. Whatever. Thank you. It's been a great conversation. Really appreciate it. Thank you for sharing your insight with all of us and with our audience. And remember, be sure to hit that subscribe button on your channel here to keep up with the latest health and wellness information and tips from our experts, include Dr. Dapo. I'll go with that. Thank you for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.